Welcome back. Did you know that it's National Sleep Awareness Week? Millions of Americans, millions of us just don't get enough sleep, and it could be affecting your health. Here to talk more about the importance of a good night's rest, Dr. Franklin Roesner is with us here this morning. He's a sleep physician. And I mean, first of all, we should establish, of course, why sleep is so important on a daily basis.
Well, that's a good question. It's not been absolutely defined, but we do need that to have a healthy lifestyle. I like to think of it as being one of the really three main things that we need for a healthy lifestyle. You think of a healthy diet, you think of exercise, so you should think of a good healthy sleep as part of that.
What are the biggest reasons people lose sleep? Whether is it not enough time, mentally just not ready to shut off the day? What is it that keeps most of us from that?
Yeah, we all live pretty busy lives, so getting adequate time for sleep, dedicated for sleep, it's different for everybody, but 7 hours average for most adults. It's age dependent, but talking about adults, about 7 hours of sleep. Well, if you have obligations in the evening, obligations in the morning, that's going to be a major factor. There are sleep disorders that prevent us from having healthy sleep, and then there are lifestyle things. Too much caffeine, you don't fall asleep well or have good sleep. Too much alcohol in the evening can interfere with your sleep.
So if someone believes they don't have enough time or says, I can't get to sleep any sooner than this, I don't know when I can get enough sleep, what's your best advice for people who feel that way?
Well, that's difficult. So you really do need to have that schedule. You can play some catch up on the weekends if that's what's required of you given your responsibilities and your schedule. But keep in mind that, again, this is an important part of a healthy lifestyle. If you're having medical problems, if you're having emotional problems, relationship problems, work relationships, all these things can be a sign that you're not getting enough sleep.
I've always wondered what if I just kept a log of my time throughout the day, and then go back after a week or so and look, oh, that's where I was spending this time and this time. And that would take a lot of diligence through the week, but maybe it could answer some questions for you.
Well, I like that idea. Maybe I'll try that in the clinic. Find some place where you could carve out, take one or two things that you don't need to do and add that to the end of your day.
Maybe you can identify something and use it for sleep instead. All right, Doctor, thank you very much for coming in. A reminder,
anytime.
it is Sleep Awareness Week. Make sure you try to get your Z's.